Hello, my name is Dr. Marashi. Today we're going to be talking about laser vaginal rejuvenation. The instrument and the laser that I use, and I'm absolutely in love with, it's FemiLift from Alma Laser. The good thing about FemiLift is it's CO2 laser, very accurate and pretty safe. The other great thing I love about this laser is that it literally has no downtime. You come to the office, 10 to 20 minute treatment, and then you go home. You can have intercourse 2 to 3 days afterwards, so there's no downtime. There's no anesthesia involved. Almost painless, very small tingling some patients feel. And you come back for another treatment between a month to month and a half, and treatments are going to be completely enough. They did extensive research about this, and I'm going to tell you how it works. First of all, when you come to the office, we talk about it. This is the probe. You're going to get your individualized cover. So this only belongs to you. This is a demo unit. That's why it has this sticker. It goes on and basically it fits here. So this cover, afterwards when we are done with it, you're going to take it home and you're going to bring it for the next treatment, meaning that nobody else is going to be using this cover. What it does, the CO2 laser is coming through here, through all the mirrors, and gets to here. It's gonna shine inside the vagina. So what it means, it goes all the way inside the vagina, and we turn it so it circumferentially heats the vagina, the inside of the vagina. What does that mean? It's not just heating that matters. What it means is that laser beams are gonna hit the wall of the vagina, and it promotes building of collagen. Collagen is what we have in our tissues, in your skin, inside the vagina, and that's what basically causes the tissue to be firm. So after 3 treatments of this, you're gonna feel much firmer inside the vagina. Also, you're gonna feel a better tone, you're gonna feel more moist, so the health of the vagina is gonna be much better. I love it because it doesn't need anesthesia, it doesn't have any downtime again, and it is very, very safe. Most of my patients that done it, they came back for the 2nd and 3rd treatment. The other thing that's really good, remember, after vaginal delivery and after any pregnancies, the vagina gets loose. The other thing that happens is that sometimes women have problem with urination, meaning that you cough, you sneeze, you laugh, you lose a couple of drops of urine. What happens when the vaginal wall becomes stronger, you see, in the front part especially, it protects the bladder that's sitting in front of the vagina. So bladder is sitting here, and when the vaginal wall is thin, bladder can push inside the vagina, and you cough, you can lose some urine. However, when you do this treatment, it makes this thicker and it makes it healthier. So the urination is going to be much better. You can hold your urine for longer, and you're not going to be losing your urine after coughing or sneezing. It doesn't work the same in everyone, but I'm pretty confident based on the cases that I've seen and the cases that I see other people do, patients have a really good outcome with it. There are some research in Europe specifically, and I'm going to post the pictures of before and after of those research. Histologically, those pictures, it shows how much better the epithelium, which is the lining that covers the vagina, how much better it gets and how much thicker it gets. That's why the vagina becomes more moist and healthier. If you think this procedure is something you want to try, come for a free consultation. Of course, if you like it and you think this is for you, you can go ahead and do the procedure the same day. It's only going to take 10-15 minutes. Thank you and have a good day.